my name is Dr. David, and welcome to another DEI podcast. Today we want to focus on mental health and mental health disparities that are important here in Georgia and across the United States. And I have a few experts with me today to help us talk about these topics. And I want to remind everyone that we do have CME available, so please check that at the end of the discussion. I have today Dr. Devin Vicknair, Dr. Contrucci, and Dr. Brenton Otey. And I want them to introduce themselves and just give us a brief, some brief information about them.
Okay, I'm Dr. Devin Vicknair. Glad I'm here with you, and I am the Director of Behavioral Health for Family Medicine Residency, and I'm also adjunct for the Psychiatry Residency as well.
Great.
Hi, Dr. David. I'm so happy to be here, that you asked me to be here. I'm Dr. Contrucci. I am a pediatrician for a very, very long time, and I am the newest faculty member in the Family Medicine Residency here in Gainesville, and I will be teaching pediatrics to our Family Med residents.
Awesome.
Hello, Dr. David and everyone else on the panel. Thank you so much for having me. I'm Dr. Brenton Otey. I'm a second-year resident in the psychiatry program here at Northeast Georgia.
All right. Thank you. Thank you all for being here today. And so we're going to jump into this. I did a little bit of research, and it seems like mental health and mental health illness affects about 20% of the U.S. population. And some of the issues related to caring for mental health are quite diverse in terms of access, in terms of stigma that's associated with that. And that is sometimes worse in minority populations where they may not have ability to seek care, or sometimes don't want to seek care because of stigma and other things. So those are some of the things I wanted to touch on. And I think it's important to try to flesh out specifically what we're talking about when we say mental health. That's focuses on emotional, psychological, social issues. So I want to start with Dr. Otey and say, what does mental health mean to you?
That's a good question. Kind of like you were saying, Dr. David, mental health is an overall combination of their emotional, psychological, biological factors that go into it that make up how a person is feeling and how they're being, how are they existing at that moment. That's kind of how I view mental health.
Right. Dr. Vicknair, what would you say?
I agree. I think it is comprehensive, so it's more than just one thing. I think about it on a continuum and I think the way we even use diagnostic indicators in the Diagnostic and Statistical Manual for Mental Disorders, it's on a scale now from, say it's anxiety or depression. It'll go from mild, medium, or severe. So I think considering those factors, as well as looking at how it's interplaying or interfering with a person's life, whether it's anxiety or depression. But ultimately, people can seek treatment when things are on the low end and things are going relatively well. And then sometimes people are hindered by access or other things that you mentioned. And the problem escalates and gets worse, and then they're maybe pushed into health or have no choice.
Dr. Contrucci, same thing.
I love what both of you said, and I think the way I would add to that is, I'm a pediatrician, so I'm a very holistic physician, and I have the T-shirt that says mental health is health. And so when I think about it with kids and adolescents, it's the entire child, and when I'm taking care of this child and I'm looking at their mental health challenges, et cetera, I'm looking at the whole family. I'm looking at what is the situation. It's so much an environmental part as well. What is the toxic stress this child's been under? What is some of the trauma perhaps this child has experienced, witnessed, et cetera, et cetera. So I think when we talk about the disparities in mental health, I think children in general are one of the populations that have the disparity. But then when we drill down even more and we're looking at minorities, we're looking at gender differences, et cetera, I think kids really I'm so glad it has come to the forefront because it's something that just really was existing long before COVID. And pediatricians knew that, and I think all of us knew that. I love what you guys said, and I have to agree with all of that. And I think from the pediatric perspective, there's even a different layer there and a uniqueness to it.
I do want to touch on that, and I did want to go back and say that you did not mention that you're on the American Academy of Pediatric Suicide Prevention Council.
Yes,
Right.
yes. Thank you for mentioning that. So I'm one of the ambassadors for the Georgia American Academy of Pediatrics. The National American Academy of Pediatrics initiative is we have partnered with the AFSP, the American Foundation for Suicide Prevention, which is a national organization. They each have state chapters. So I'm one of those suicide prevention ambassadors. And really just to raise awareness, to try to start destigmatizing this. I think this is what we all, that's why we're here. We feel passionate about this. To me, again, mental health is health. It's not any different than talking about asthma and diabetes. I went to med school a really long time ago, but I'm pretty sure the brain is still connected to the body. So I think that is part of it. But yes, so I'm really super excited and just feel very privileged to be able to go around. Our action plan for this year is to train as many clinicians that do primary care that see specifically children and adolescents on suicide prevention training, screening, doing brief suicide assessment, suicide severity assessments, dispositioning these kids, giving them the tools so that they feel comfortable being able to do this. Because unfortunately, we don't have enough psychiatrists. We certainly don't have enough child and adolescent psychiatrists. We don't have enough psychologists or therapists. So sometimes it's a tag you're it situation.
Right. And one thing you said earlier, I want to touch back on. You mentioned that you thought of children as fitting into the disparity context or conversation. And I agree, because for the most part, until you're older adolescent, you're probably not going to the doctor on your own. You're not usually able to advocate for yourself.
Yeah.
So it puts the child in kind of a dependent position, definitely a dependent position. So there is a little bit of an issue there potentially. And I think it's incumbent on the provider to take any opportunity they have to ask about mental health in children when they're coming for a sports physical or coming for a general check, or they're just coming to get their shots. We need to take those opportunities because we may not get another one.
I am so glad you said that. And that is so incredibly important. Anytime I do a sports physical, it's not just a sports physical. Sometimes I regret that. Sometimes I don't. No, but I think you're absolutely right. You've got to take the opportunity. I think that's one of the things that's so different about pediatrics too. There's so much observation I'm doing when I walk in the room. How is the parent and the child interacting? And even touching on not even just the preteens or the adolescents, but early childhood mental health. It's starting to become more of, it's starting to get looked at a little bit more. People are looking at it. And, I had a mama today, coming in. She's clearly got some postpartum depression. That absolutely affects babies and kids from early on. And so it's about observing, it's looking at what's the interaction, what's happening in the home, what's been the recent changes. And I think that's where, especially if somebody's not as comfortable with children as obviously a pediatrician is, that you have to feel confident in asking those kind of questions. And even starting with age about 11 or 12, depending on how mature, sometimes 11, I start really discussing confidentiality and adolescent confidentiality to start setting that precedent that, hey, I want you to start taking some charge of your health, and everything we talk about is not going to be reported back to your mom or your dad or whoever your caregiver is, unless I feel like you are going to harm yourself, harm somebody else, or somebody's harming you. And I think that parents need to be really aware of that. And that's something I think a lot of physicians maybe aren't comfortable with because, well, it's just a 12-year-old. What do they know? But they will just open up, let me tell you.
Mm-hmm.
So I'm glad you asked about that.
Yeah, I think that's definitely important. One of the things I noted when trying to read up on some things is that the suicide rate in young folks from 10 to, I believe, 24 increased from about 2007 to 2019. It came a little stagnant or steady the past few years after that we have numbers for, but there was a significant increase. And depending on the year, was the second or third leading cause of death among adolescents. So that's pretty significant, kind of striking numbers when you think about it. So that age group, I think we definitely have to pay attention to. Are there any specific factors that Dr. Vicknair you think may that we should look for when we're talking to adolescents? Anything that we may not assume or may not think about in adults?
That's a great question. I think that there's a lot of overlap in symptoms, but they can manifest a little bit differently. And I think when children and adolescents are trying to find themselves and figure out where they fit in the world, they're going to change friends, they're going to have changes in their sleep habits, hygiene. So some of that, it's great to have a pediatrician or let alone psychiatry, that is tuned into what is kind of normal developmental processes. But it could be overt signs of a person shutting down, they're changing their eating habits, they're eating too much or not enough. They may even be saying things like, don't think I can go on living anymore. I don't want to do this life anymore, as well as writing things out or posting things on social media, overt signs of, I just can't do this life. There's also non-suicidal self-injury, where people will cut or burn or injure themselves in a variety of ways. And when they do that, they may not be wanting to end their life, but more so trying to cope or express the emotion, to make the emotion more physical and apparent. And typically they don't do that in obvious manners. If they do, they may cover it up. So a parent may not see these things, but however, a pediatrician or a family medicine doc may recognize these, especially in an exam room doing a physical exam.
Right. Well, thank you for that. And you guys are great. You're giving me all these little key words that I can pick up on. So it helps me not forget. But you did mention social media. And I know that everyone smiles.
How much time did we have, Dr. David?
Well, we'll have to ask Kennedy. He wants to go home at some point. But I'm going to start with the young folk.
Oh,
Dr. Olsen.
oh, so it's never. Okay.
Wait, it's Wait.
We're always good at.
So for me, social media is not, I think, as much of is not as important as it seems to my children. They are on something seemingly 24/7. If they're not asleep, they're on the phone, they're on social media. How do you look at social media in terms of potential effects on mental health when almost every young person is on there, but obviously not every young person has mental illness? How do you kind of parse that out?
Well, I think social media, kind of like many things that have been created, is a tool that can be used for good, and it can also be used for evil. But one of the things, especially when I'm talking to parents, when I was doing my child psych rotations, is kind of teaching them how to have those discussions with their children, because a lot of times they're not really sure, or they just outright try to ban it. And it's like, well, if you're not putting in the effort to do this right now, they're going to learn from someone. So you want to teach your children how to kind of navigate those situations, how to look for potential dangerous things, or and then more than just that, what types of social media are they engaging in? Because there can sometimes be sort of like a positive feedback loop for, depending on which types of groups you use, like TikTok. It's really easy to go down a rabbit hole for so many things, but there's this sort of false perception. It can lead to some body dysmorphia, especially in the younger individuals. I mean, I was seeing some TikToks the other day, and it was about skin routines and like 11-year-olds, and I'm like, 11 years old, you're already worried about your skin? Like, there's a lot of things out there, and you just got to teach the kids and how to navigate those sort of situations, how to be strong, how to be more confident in themselves. And don't be afraid to, if you're suspicious that someone, isn't acting like themselves, or maybe if they are being a little bit more negative, or just anything is off about their character, like, don't be afraid to ask questions, see what's going on, talk to them. Because I think a lot of the times when I ask, and it's kind of so sad, when I talk to children that are coming in and for whatever reason, and I'm asking, who's the person that talks to you, or who do you feel like listens to you? And they're usually like, no one. So I think just opening that door for them is a great way to start.
Yes, Dr. Contrucci, I know you have one or two thoughts about social media. So
I love what you just said, Dr. Otey, because yes, you are, you grew up with it, right? And so I understand that. And I love what you said about talking to the parents. And one of the things that I talk to the parents about is having like a family screen time, screen-free zones. If we're sitting down at dinner, there are no screens. That includes the TV. Let's have a meal together. I talk to the parents about it's about connection and social media for a developing brain, because I think that's where people don't think about this. It's one thing for me as an adult to get on Instagram and whatever, okay, I didn't get any likes on this picture, who cares? But if you're thinking about a 12-year-old, a 13-year-old with these burgeoning, peer pressure is everything, my peers are everything. I call it peer pressure on steroids is what I call social media, because, girls we know are much more affected by social media. For boys, it's more the video game aspect. But I love what you said about talking to the parents about it and connecting with your kid. They're teenagers, right? Teenagers are teenagers. They're not going to go in their room. They're not going to talk to their parents. That's normal, right? That's normal development. But when you're seeing true isolation, not talking, and kids are really smart about the social media for the parent, there has to be some limits, because kids also, they are so smart at figuring out, I have no idea how it happens. They make a fake account, they do this, it's hidden in their phone, all that kind of thing. It's about having open communication. And I also talk to the parents, I call them out a little bit and say, tell me about your use. Because when you walk in the room and mom's on her phone and the kid's on theirs and nobody's talking to anybody. So I kind of, it's about modeling behavior too, right, for the parents. But I really see there's just some really fascinating research that's coming out about when all these kids got a smartphone, 2011-ish, 2013-ish, we have seen this I'm not saying it's causation, but this huge increase in all the mental health issues. Is some of that because we're realizing it more? Probably. Maybe because we're screening it better? Probably. But it goes back to, as a pediatrician, I always think developmentally, so I think about a 10-year-old, an 11-year-old, a 12-year-old, an 8-year-old. They don't understand the artificiality to this stuff, right? Their brain's not there yet. And then if they're peer pressure on steroids and I only got 2 likes today, but my friend got 27 likes, that kind of thing. So I think that social media really is key to being responsible about it, and parents having to put some limit. You're still the parent, you've got to have some limits, just like you would put boundaries with other things. And also, just to caveat off of that, when these kids are staying up until 2 o'clock in the morning on their social media, right, so they're getting 6 hours of sleep. Mm-hmm. Well, no wonder they can't pay attention and all this. Like, who can? I can't on, 4 or 5 hours of sleep. So I think social media is really key, and the awareness for physicians to think about it developmentally with a child. A preschooler, when a mom comes in and says, look, he's got his ABCs on his tablet. No. He needs to be feeling, touching, sensory for a preschooler. Developmentally is how they're going to learn. So I hope that makes sense. I always think development.
It makes me think, too, about just the difficulties of parenting. Because if you're the parent that says you're cut off from this, like you cannot use this during this time, while their friends are using everything, it creates this turmoil.
Absolutely.
Right? I mean, at our house, when we have dinner, I let this go because it was too much of a fight around dinner. But So I'm guilty of that as a parent. But I would even say when my son picked up their phone or looked at it, I'm like, who did you invite for dinner?
Oh,
You
I
know,
love
and
that. That's great.
them, right? And it worked for a while, and now I can't fight it. You know, it's too strong. But when talking about this epidemic and what's happened with social media and the use of phones and the distractions, it's interfered with relationships too. You know, how do you handle turmoil in a relationship or conflict? Well, you just unfollow.
Right.
You know, you just disconnect from them as opposed to having a conversation.
That's it. There's no real connection. That's what it is, right? These kids are learning socialization from a very early age, and they're learning how do I do conflict? How do I do that? And in social media, I'll just block them. I'll just unfollow them.
Right.
That's not
Right.
real connection, and that's not real skill building, right? I think that's a great comment.
And I think it varies across cultures as well, right? Because you can have that parent that's pretty strong and just says, no, you can't have this, or maybe they don't have it, right?
Mm-hmm.
But the other person does. And there's this lack. And,
I think that's important obviously for the parent to be involved, even if it's to say, recommend, I want you to limit this. I think it may be counterproductive if a parent is like, no to everything.
No,
right.
You can't have
Right.
Agree.
Right.
I mean, that's
And is it
gonna
going to work?
cause a revolution.
Right. Right.
Because everybody.
Right.
But I think having that presence, having the parent discuss it, having the parent say, why they think you should limit it is important, because I think that shows the young person that at least they are interested, at least they care, as opposed to a household where they don't even talk about it. You run free. I mean, maybe they're really not into it, but you're not saying anything. I will get more into it. This is the only interaction I have with people, or what have you. So I think showing that interest is already important, even if they don't listen to you completely.
Right. They're not gonna, right? And there's an interesting. It's going to be in one of my lectures that are coming up. Not a research, but a survey. One of the Pew one of these Pew research surveys or something like that. I can't remember exactly what it was. If you really drill down with adolescents and you talk to them about, and this was what it was showing, they actually get really anxious about social media, especially girls. And they'll say, yes, I know I'm doing too much of it. There's a lot of self-awareness. And I think, again, it goes back to they're aware of it, but all my friends are doing it, right? It's that developmental, the peer pressure, et cetera. So if you can capitalize on that, tell me what you think about your social media. Kind of that open-ended, tell me about your social media use. Tell me what you think about it. What does it make you feel like? I think it really can open a door. Maybe they can't talk to their parents about it, but maybe they can find a trusted adult, whether it's you coming in and seeing them, you coming in and seeing, one of their coaches, one of their teachers, right? Where you say, and they may open up and say, I don't know what to do about it. Because it really is, it's addictive.
It is.
It's a problem.
Very much is.
And when you think about their developing brains from the scientific sample, neuroscience, the dopamine hits that you're getting, isn't that what gambling's all about? It's a dopamine hit every time you get that every time you get, so I think it's something, I love what you're saying too, right? You can't just say absolutely not. It's not going to happen. It's just not. But to figure out how to have these conversations and open up these conversations, because kids are smart. And I think a lot of kids already are like, well, this really is not good for me,
But they don't know.
I think really to piggyback off of that, a lot of people, they do underestimate how intelligent children can be.
100%. I think kids they're the best humans ever. Just a, PSA, best humans ever. And they really are smart, and people absolutely underestimate them. You're 100% right, Dr. Otey.
And I think, even as you're talking about that too, I think that being able to educate the parent a little bit, here's a good conversation to have. And even pulling this into mental health, I see the generational change that you have. I guess if we do the grouping, I guess it's Gen Z and millennials, maybe, I can't remember. But you you have the parent when it comes to mental health, they're still behind, still a little bit of a stigma for that. Whereas you've got this younger person that's like, no, we talk about this. We're on these websites. So there's this discrepancy there. And then when they get a little bit older, they come to see me, and they're like, I couldn't get the mental health. My parents didn't want them to take medication. They didn't want a label. They didn't want it. So they had untreated ADHD or depression or anxiety because of that belief or that concept or that cultural context. And so now they're with a different dilemma of, okay, I'm getting help, but now how do I talk to my family about it, whether they're 18 or not? So kind of going back to helping the parent communicate and making them more aware of all of this as well.
And making them comfortable with, I think the piggyback on that that's a great point, because the piggyback on that is, and especially when we've got different cultural contexts, et cetera, sometimes a language barrier, making them understand, not making them understand, that's not quite the right word, helping them to understand and destigmatizing, this is not any different. I use an asthma analogy all the time. That's my go-to, is an asthma analogy, or a diabetes analogy. If you had asthma, we would talk about how we're going to help you be better from it, right? And nobody would think twice about that, right? And so if we're talking about maybe you need some medication because your brain, I'll say to the kids and the adolescents, your brain works different, and that's a beautiful thing. It's a beautiful thing because we all have different brains, right? But just because your brain works a little differently and it may need a little bit of help right now, and here's the tools in your toolbox. I always like to talk to them about, here's your toolbox, okay? And here's some of the tools for you to help that brain. Just like if you started having an asthma attack on the baseball field, nobody would think twice about you pulling out your inhaler and helping your lungs. Right. So let's help your brain a little bit. So I feel like approaching it that way, and sometimes I can really see the parents sort of go, oh, okay, that kind of makes sense. Not always, sometimes. Sometimes. And, it's just, I think it's really helpful to always come back, especially as physicians or psychologists, coming back to, mental health is health. So we're going to treat this as a condition that there's a lot of hope and there's treatment for it, and we can do something about this, and you can do something about this, empowering them.